Hi, I'm Hannah Gideon. I'm a postdoctoral fellow at the University of Pittsburgh School of Medicine. I work on tuberculosis and I work with Dr. Joanne Flynn.
My name is Philana Lin. I am an assistant professor at the University of Pittsburgh at the Children's Hospital of Pittsburgh. So we were asked, how did we get into the line of work that we do now? So I am actually a trained pediatric infectious disease physician who basically wanted to work on an infectious disease, and so I work on tuberculosis also. Part of the reason why I do research is really to search for the reasons why some people die of tuberculosis and other people don't. And that has really promoted my career in terms of trying to figure out what are the components of the immune system that actually protect people, and what are the components of the immune system that actually make people die of tuberculosis.
I got into this line of work to tell a backstory. I grew up in India in a really remote tribal region where my father worked. And there were a lot of people who were infected with tuberculosis and HIV in the later stage, with the personal experience from friends who had the plight which I saw growing up. That led me to choose the field which I wanted to work on, understanding how TB affects the immune system.
So we both started in Joanne Flynn's lab, and we both work on similar studies but ask different questions about it. So in fact, we do a lot of back and forth question and answer and how do we look at different things. So it's actually been really helpful.
Yeah, I joined as a postdoc in Joanne Flynn's lab where Ling is working as well. We actually work together in one project and we discuss and we work hand in hand with many of the projects and we throw our ideas back and forth.
So actually there's a lot about immunology that's new, right? So there are a lot of things that we're just discovering, and so people are discovering, for instance, new things about RNA that we never knew about before, and so there may be genetic predispositions for why one person is more susceptible to an infection versus the other. So then we take what we've learned and ask the question whether or not that affects Mycobacterium tuberculosis, which is what we work on.
Also on the technical side, which is I'm more focusing on, is understanding what other markers or something we are missing, which others are studying in chronic infections, which we might be missing and would be relevant to our field.
Well, I haven't learned any skills yet. I have a lot of new questions that I want to focus on after being at this conference. And a lot of different ways of analyzing the existing data that we already have, which is actually very helpful because it gives us a new perspective on the way we might think about the problem, which is actually really nice.
Yes, I agree on completely everything she said, and also the vendors, and they bring out the new techniques and what's more available, which we otherwise mostly won't know about or hear about. And also looking at people in different fields using techniques which we don't use, which might be helpful for us.
There's more than just science, though, that's here, right? There's a lot of career advice that people give you, a lot of networking, and I was just at a session today about the NIH and what the budget is proposed for the NIH and how to write a grant and how to really, how to learn the nuances of how to get a successful grant. So it's just not the science, it's also the career advice that you can get from this meeting. Probably my favorite session was on the systems biology session because there were 4 or 5 different presenters that all had the same types of data, but were able to look at it in a very different way that all translated to human disease and were novel ways of looking at a problem. Taking a large amount of data and reducing it to a very simple question and answer.
My favorite is also the systems biology one. It's being thorough in what the data we have and going one step at a time and asking specific questions and bringing out the answer which otherwise we wouldn't have.
I have the advantage of having the best of both worlds because I take care of patients and then I also get to do bench science. So I can look at a problem from a human perspective and say, these are the different things that we see and why is that, and begin to ask those questions in a basic science context. And so it's great when you have a driving force or questions in your mind that you can actually answer and try to address the curiosity that you have naturally going on.
What I love about mine is I work on the bench mostly, and I can ask questions which I can find answers to. And sometimes I don't, and that leads to another question which I can go further, and the research that keeps my interest going.